Okay, do you want to just introduce yourself, your name, and tell us a bit about your job role here?
Yes, my name's Sarah Vickers. I've been here nearly 6 years now. I'm a member of the reception team. There are 8 of us. We all do basically the same job. Our main job is answering the telephone and making appointments, but we often have little jobs to do, each and every one of us.
Okay, can you just tell us a little bit about your day-to-day role and how you make sure that patients see the most appropriate person within the surgery?
Yeah. The phones are switched on at 8 o'clock and it's mad. The phones are ringing all the time. If somebody rings up and wants an appointment on the day, because we offer same-day appointments, we would ask the patient what the problem was and then decide who the best person was for them to see. So if it was a straightforward chest infection, swollen foot, something like that, we would probably put them in with one of our advanced nurse practitioners. If it was something more complicated, or we thought it was more complicated, we'd refer them to the doctor. And the doctor would either see them himself or herself, or make an appointment for them to see the necessary nurse practitioner.
Okay, and so there's a variety of different clinicians and roles that you have at this surgery, including pharmacists, physios. Can you just tell us how you think that improves your offer and your offer for patients really within the locality?
Yeah. If a patient rang up, for instance, with a stiff neck or a stiff arm or pain in the arm, and you ask them if they think it's muscular, we have a physiotherapist who does a first assessment here. I think he's here 3 times a week. And a lot of patients will see him, have an assessment, and then he will do the referral if necessary. If not, he will deal with the patient himself. So this takes pressure off the GPs and the nurse practitioner. A lot of people ring to speak to dispensary. We have an answer phone so they can ring up the answer phone and leave a repeat. But if they need to speak to a dispenser, we have the telephones manned in the dispensary in an afternoon between 2 and 5. And we recommend that people ring and speak to a dispenser if they need one.
And what do you enjoy most about your day-to-day role here and working with the team?
We're very busy. Actually, we're a very good team at the moment. We've got some really good characters and good people in the team. The best bit about the day is just making sure the person that's on the end of the phone is happy with what they get and that they're satisfied that they're seeing a GP today or a nurse practitioner or they're getting an appointment. So I think that's the best thing of the day. I mean, it's very varied. Every day is different. We have lots of different things happening. But the appointments, getting people to the right place, I think is the most rewarding.